Hi, this is Christine again. I'm going to show you how to remove an NG tube. So first things first, I verify my patient's order outside the room. I have Dan Brown, who I took care of a couple days ago, who's had an NG tube, and it resolved on its own, so he never needed surgery. So that's a fantastic thing. So makes sense that I have this order for my patient, and I verify it. So my next thing is I gather my equipment. I don't need much for this. Basically like a chucks and an emesis basin in case he should throw up when I take the NG tube out. It's typically on going in that they throw up, but you never know with the gagging and stuff that can occur. So we are prepared. I'm also going to have some oral swabs and stuff like that so that he can do oral care afterwards if he would like, as well as some tissues. Okay, so the next thing I'm going to do is knock, knock, knock. I enter my patient's room. I like the foam outside, inside the door there. Hi Dan, my name is Christine. I'm going to be your nurse again today, okay? I had you the other day when you had that NG tube put in. He says he remembers me. Okay, good. So first thing, you should be pretty excited. Doctor gave us orders to remove your NG tube. It looks like your obstruction resolved on its own. Oh, yeah. Great, good. So first what I'm going to do is I'm just going to have you verify for me your name and date of birth. Dan Brown, he states, the date of birth matches the wristband. Good. Do you have any allergies, Dan? Nope. Okay, good. So, we are going to remove your NG tube. I promise you, it is so much easier coming out than it is going in. You're going to love it. This is great. All right, I'm going to put your head up just ever so slightly. You doing okay? Yeah? Okay, good. So, how this is going to work is basically, as I'm pulling the tube out, before I do that, I'm going to have you take a breath in. And when I pull the tube out, I want you either to hold your breath or exhale during the whole time that I remove the tube. And that's simply because when I pull the tube out, there may be still some contents that are in it that then could possibly, as I pull it out, go into your lungs. So by having you either hold your breath or by exhaling, it helps prevent those contents from going into the lungs, okay? He says, okay, I'll exhale. Sounds great. All right, so I've washed my hands. I am just going to put a chucks down over your shoulders again. Next thing that I'm going to do is I'm going to grab a pair of gloves here. And I'm just going to turn off your suction for one quick second. Good. Again, I'm just going to clamp back here, disconnect you from your suction, put the end back on just so I don't make a mess on your chucks here. What I always do is I hold this up, I turn my suction back on for a minute, just pretend if there was stuff in here that it would just suck it all in there, and I'm going to set it aside for a minute, and I will deal with it when I'm done getting that tube out. Okay? Alright, good, now that is done. Let me just unhook this from your gown, unpin you here. Perfect. I'm going to give you some tissues as well as the basin, because after I pull it out, you might see that your nose is watery, maybe your eyes are watering and stuff like that, so I'm going to give you this to use afterwards, okay? So it's okay, so he's got that there. Next thing I'm going to do is I'm just going to loosen up this tape around your nose. Good. All right, Dan, so I'm getting ready to the point where I'm going to be able to pull this, okay? So I want you to take a breath in. Okay, you ready? Now exhale, 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 exhale. Great job. Maybe he's doing some coughing and stuff like that. That's normal. And what I always do is I just kind of pull it all out. Take it off to the side. I looked at the tip. You don't typically see like a central line or something like that where you're looking at the tip to make sure it hasn't broken off. I just look to make sure the end is there and we're all good to go. I can't tell you if I've ever really seen any kind of end come off of an NG tube. I'm just inspecting the tube as it comes out, just like anything you pull out of the body. I'm going to go ahead and throw that away in the garbage. Okay, how's it doing? Maybe you have a little bit of bloodiness around the nose. That's just from irritation of the tube being in here. Not much, but we'll keep an eye on that. I'm inspecting the skin just to make sure it's looking good. Looks great. I can maybe help him out with a little bit there. Did you want to do any oral care, Dan? So give him that if you would like to do any kind of oral care or anything like that. Does it feel better? Oh yeah, it feels a lot better. Good, 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 good. So I'm not done yet though. I'm just going to do a little bit of cleaning up in your room here. Did you want me to put your head down? He says, sure. I put his head down a little bit, making sure he's comfortable. Good. He's got his call light, stuff like that. I still need to tend to my my contents that are in my container here. So I'm gonna disconnect all of this, make sure that I note how much I have put, or how much has been taken from his body, so I can mark that in the output. I'm going to dispose of that properly according to my facility procedure, either, you know, like dump it down the toilet, or maybe some places have like powder or something that you mix in there and then it turns it solid, so you can throw it away in the appropriate place. So I'm going to take care of that. I am going to go ahead and take my gloves off, wash my hands. Dan, can I get you anything else right now at this moment? He says no, he's good. All right, my scene is safe. The bed is in the low position. He has his call light. I'm going to make sure to take care of all of this stuff, and then I'm going to go ahead and document that I removed the NG tube, how the patient tolerated it, any kind of contents that were pulled out, and that is it for NG tube removal.